Welcome back to the Pops Podcast, where we uncover real, raw, and rarely discussed truths about pregnancy, birth, postpartum, and beyond. I'm your host, Dr. Emily Muery, prenatal and postpartum chiropractor, birth doula, and founder of Move Moms at Move Chiropractic Boulder. Today, we are diving into the umbilical cord. What does it actually do? Why is there always so much conversation about whether to cut it, whether to wait, its benefits, all the fun stuff, whether it does anything or not. So I want to dive deeper into it. I get the question pretty frequently in our office. All the questions that usually come up about cord clamping, I'm hoping to answer here. If I don't, please drop it down below in the comments and I will get back to it at some point. So let's dive into it. What does the umbilical cord actually do? Why is it important? Why is it so talked about? So we tend to think that the moment baby is born, everything shifts instantly, which it does. They cry, they are trying to breathe for the first time, and the umbilical cord is just a leftover string that attached baby to mom or gave baby nutrients during pregnancy. But that couldn't be further from the truth. It does a lot more than just give baby nutrients. It's just a string from baby to mom. In reality, the umbilical cord is actively working on those early minutes after birth, trying to get as much blood to baby as possible. It's not just a passive tube, it's a living, pulsing bridge between the placenta and the baby, continuing to do life-sustaining work. There's a lot of iron, there's a lot of blood, there's a lot of protein coming through that umbilical cord, even in those early couple minutes as soon as baby has come out. So here's what the cord continues to do post-birth. It transfers vital blood volume. The placenta retains about 1/3 of the baby's total blood volume or supply at the time of delivery. So the umbilical cord acts as a conduit to finish that full blood transfer. Think of this like nature's version of a blood transfusion. It's already matched, it's already perfect, it's perfectly timed. And then it goes on to continue supporting the transition into breathing. So while the baby begins to take their first breaths, their lungs are still waking up, and the cord continues to supply oxygen-rich blood, giving the baby a gentle runway rather than a sudden drop-off of, hey, you need to supply your own oxygen for your blood right now. At least there is still blood coming into their body that is oxygenated as they continue to work on getting those first couple of breaths and then getting that oxygen saturated into their blood to go and supply the rest of their body. This extra blood is full of iron for the brain to continue to develop, and then there's stem cells that also support organ maturation or maturing your organs, immune defense, and tissue repair. Delayed cord clamping has been shown to boost immune markers and may even support long-term healing capacity. And lastly, the cord is going to pulse until the job is done. In most births, the cord continues to pulse anywhere from 1 to 30 minutes to an hour to 2 hours long. I really haven't seen anything go longer than 2 hours, but it is possible for the cord to continue pumping after an hour long. That pulsation is a sign of the transfer still being active. That blood, the stem cells, all that is still pumping through the cord. If that cord still has any tautness or tension within it, when it stops, the cord will usually be white or very limp. Not just like a noodle limp, like really limp, like could slip out of your finger limp. A lot of times we say that the cord has stopped clamping when it looks like it's a noodle and it's white and it doesn't look like it's pulsing, but just because it's looks white and not pulsing doesn't mean that it isn't still doing work. So it is interesting to see how different practitioners analyze the cord, not just for time's sake, but when they're telling mom, even if they're within their 30-minute window to cut the cord. Often practitioners are like, okay, look, the cord is limp, it is no longer pulsing, and often I disagree. But a lot of times moms are like, good to go, let's cut it. So this is what this episode is for, so that you can have a little bit more backstory behind what you're naturally told in most hospital settings or even some birth center settings. I know birth centers, especially here in Colorado, are more limited by their governing bodies, and they can't always allow moms to have these mom-led decisions or postpartum mom-led decisions because they are required to follow their state's rules. So always good questions to ask just so that you can be prepared, ask questions, and transition your birth space if that is not the space that you would like to be in. When the cord is clamped too early, often within 15 to 30 seconds of birth, when the baby is cut off from the cord that quick, typically up to 100 milliliters of blood is missing still in that cord that they were meant to receive. This is not just fluid, it's full of iron, stem cells, immune cells, and oxygen. Think of it like interrupting a blood transfusion mid-flow. We would never do that. It's the same for baby, yet we're doing it all the time. Then the iron for that brain development, the iron that's coming from the cord isn't just about avoiding anemia. It's essential for myelination, which if you've ever been in any science class, you might have heard myelination before, and there's so much to it. I'm not going to get into all the nitty-gritty of the science of it, but basically this is the process that insulates the nerves around your brain or in your brain, and then it supports early cognitive function and development. One study found that babies who received delayed cord clamping had 45% higher iron stores at 4 months of age. That's amazing. I'll just give you that piece of information, that piece of evidence. And then going into the stress response and lung function. The clamping moment overlaps with one of the most intense transitions for any human experience, and that's moving from fetal to newborn circulation. Cutting the cord early forces the baby to switch to lung breathing before their lungs are fully recruited and perfused with blood, which can often create distress or unstable oxygen levels. Again, baby comes out, cord is still connected, placenta is actively being delivered. That cord is getting enough oxygen-rich blood to baby's lungs so that baby can wake those lungs up enough in their now transitioned to real-world time to use those lungs to actually engage their own breath and their own breathing mechanic. The hidden cascade of all of this, early clamping can unintentionally set off a cascade of downstream interventions. Need for artificial oxygen, breathing support like a CPAP or intubation, NICU monitoring, or difficulty regulating temperature or blood sugar. So what's happening when we actually do allow the cord to continue pulsating, and we do have delayed cord clamping? So if early cord clamping cuts off essential blood flow, what happens when we let nature finish the job? That's where delayed cord clamping comes in, and the research is very clear. Giving baby just a few more minutes can make a very lasting difference. First, we're going to see higher iron stores. Babies who receive delayed cord clamping have significantly more iron, reducing the risk of anemia in infancy and supporting healthy brain development. I have a study that showed higher hemoglobin levels and iron stores in 3 to 6 month olds with delayed cord clamping. Second, we're going to have a smoother physiological transition. Delayed cord clamping gives the baby time to fully initiate breathing while still being supported by placental oxygen. This allows gentler shift from fetal circulation to newborn circulation and prevents abrupt oxygen drops or heart rate dips. Third, we have the stem cell transfer for immunity and repair. The cord blood is rich in, I don't know how to say it, but something like hematopoietic stem cells. I couldn't say it in school. I can say it now. These help populate the baby's bone marrow, support immune development, and potentially assist in tissue repair. These cells are not cells that you can replace later on. This is the only moment to get the cells and to receive them into your body. And lastly, I have improved neuro development. Studies have shown that delayed cord clamping may support better fine motor skills and social skills by the age of 4, especially in male infants, likely due to a higher iron and oxygenation in that early infant or newborn period. All of this saying we should do delayed cord clamping. What is delayed? What is considered delayed? WHO, or the World Health Organization, recommends at least 60 seconds, ideally 1 to 3 minutes. From experience, I have never seen a cord completely done pulsating at 3 minutes. It's just me. ACOG, the American College of Obstetricians and Gynecologists, also recommend 30 to 60 seconds for infants, but they acknowledge that longer delays may offer additional benefits. And then in physiological births, waiting until the cord stops pulsating or turns white and limp is a clear sign it's time. Notice that I did not have any specific time limit on that one. It's even if you want to have a physiological birth, that means a mom-led birth, unmedicated. If this is something that you're wanting to have, even in a hospital setting, this is something to talk about with your hospital providers so that you can have a better understanding and knowledge of what's going to happen when baby comes out and what's going to continue to happen once baby is out, what's going to happen to baby, what are the cord clamping rules or choices in this hospital. So when you can better understand that, you can better process and know what you're walking into in that moment and not be surprised at labor and birth. So what about emergencies? Because emergencies do happen. Even in cases where the baby needs help, resuscitation with the cord intact is often possible. Most of the time, it is still intact. For the few babies where I've seen them need a little bit of resuscitation help immediately upon entering the world, they all had the cord still attached. They were fine, and it didn't mean that they needed to have the cord cut any sooner. This is called intact cord resuscitation, and it's supported by emerging evidence as being safer and more stabilizing, though not yet a super common practice for all birth practitioners or in all settings. Again, like I had said, it's safer for baby to have that oxygen-rich blood still coming to their lungs so that their lungs can wake up. This is saying that when we have that oxygen-rich blood coming to the lungs, it's going to be a little bit safer to actually do resuscitation for newborn infants, so that their lungs are being woken up not only by the resuscitation from the outside in, but also from the inside out from that placental cord, still allowing that oxygen-rich blood to get to their lungs. So delayed cord clamping is not crunchy, it's clinical. If you think that I am some boulder crunchy chiropractor that's just wanting to do all the, I don't even know what you would call it, all the crunchy things, this is not just a crunchy aspect of labor and birth. This is a true clinical aspect of labor and birth. It's rooted in research, it's backed by global recommendations, and it's designed by nature to keep this cord clamped, or not clamped, cord attached. Little extra bonus segment, because I know that a lot of people ask about blood banking for their cord blood. Cord blood banking sounds like a no-brainer when you hear it marketed. Save your baby's blood stem cells so that you can use them for future health needs. But what they're not always sharing is that you can't both bank blood cells and allow for the full delayed cord clamping process to happen. You can only choose one, unfortunately. Someone once told me, you can do anything you want, you just can't do everything you want. This is one of those very simple things in life that you just can't do both, so you need to kind of decide. Here's the trade-off. Cord blood banking requires early clamping, usually within the 30 to 60 seconds. Now, pause right there. Cord blood banking requires early clamping, usually within 30 to 60 seconds. If you remember just a little bit ago when I was reading what is considered delayed by WHO and by ACOG, World Health Organization recommends at least 60 seconds, ideally 1 to 3 minutes. It's pretty close to that early cord clamping that we just talked about. And then ACOG recommends 30 to 60 seconds. That's not considered delayed. So when you see delayed cord clamping, we're going to wait for 3 to 5 minutes. We're going to wait for 60 seconds. That is the same amount of cutoff that you would do for an early cord clamping for cord blood banking. Hopefully that all made sense. If it doesn't, message me and I'll try to make it make more sense, because that's just wild to me. But anyways, I want to continue going on with the cord blood banking. So usually within 30 to 60 seconds, you need to clamp the cord so that you can collect as much blood as possible for storage. This means that your baby won't receive the full blood volume that they're biologically meant to absorb during those first few minutes after birth. In most cases, what your baby gains from delayed cord clamping, like iron, stem cells, and smoother oxygenation, outweighs the potential future use of stored blood. It would be much more beneficial to have those first few minutes still connected to the cord than clamp the cord early and store that blood. So Just something to think about. I had to throw it in this episode because I thought it was absolutely wild when I was doing my cord blood banking research. I was like, oh, early cord clamping is defined the same as delayed cord clamping. So let's move into birth planning tips, especially if you are wanting some delayed cord clamping or have just specific choices around cord clamping in general. So knowing the science behind cord clamping is one thing, but advocating for it in real time is a completely different beast. Okay, you guys, I'm super excited about this new sponsor because it's somebody I've actually been working with for a while now called The Final Punctuation. It's a female-owned, one-woman editing and proofreading service. Her name is Carrie, and she has completely changed how confident I feel putting my words into the world. She's helped me with everything from my brochures to my doula contracts to small marketing things. And not only is her turnaround time incredible, but she helps you to understand the why behind her edits. She sees things that I would have never caught and somehow keeps your voice intact while making everything stronger, cleaner, and clearer. She works with all kinds of creators from bloggers, podcasters, to small business owners, marketing folks, and even students. Anyone putting their words out into the world. And if you've ever posted something and noticed a typo after, you know how it feels. One tiny error can totally kill that first impression. In fact, stats show that only one typo can increase bounce rates by up to 85%, and grammar mistakes turn away nearly 60% of readers. And I know what you're thinking about AI. Can it just take care of all my grammar mechanics? AI still struggles with tone, nuance, and accuracy, which is not a great combo if you're trying to earn trust. So if you're writing anything from podcasts to brochures, website copy, marketing materials, let Carrie take a look at it. Visit thefinalpunctuation.com to submit a request for any project and tell her that you're a Pop Podcast listener for 15% off your first order. That's thefinalpunctuation.com. Now let's get back to the episode. This is where preparation in communication and clarity come into play. If you want delayed cord clamping as part of your baby's birth, you have to name it and say it. You have to claim it and bring it into the room time after time after time. But not just time after time, you have to bring it in way ahead of time. It needs to be in your chart that it is a recommendation. Every single person in the room needs to know that it is a choice. That's also why, side note, having a doula in the room who knows every single one of your choices and can remind any new body that enters the room is so helpful so that everybody's always on the same page. So here's how we plan for it. Include it in your own birth preferences sheet. Clearly write, we prefer delayed cord clamping until pulsation ceases, or please wait until the cord turns white and floppy on your birth plan. If you're worried about the timing or the timing recommendations or standards by the hospital, you can ask them about it. What does the timing look like? I don't know what my timing is going to look like, but I am curious about what your guys' timing looks like. And if you do need to cut the cord early, like why? Why would that need to happen? Just so that you can better understand their processes of procedures and you're not confused or surprised in the moment. Ask, what is your usual practice around cord clamping? This is one question that will tell you a lot, and it'll create space for honest conversation. Involve your whole birth team. So let your partner, your doula, your birth support person know that this is important to you so that they can help advocate for you when you're focused on baby, because as soon as that baby comes out, where's your focus? It's on baby. It's not necessarily on what's happening with the cord. Have somebody ready to say, we are waiting to cut the cord unless there's a true emergency. This is really what I'm talking about, having a doula step in. I have only had to stay this one time in labor and birth, and even in that moment that I had to say it, pretty much all of the team was on board. There just happened to be one new person in the room, and I wanted to make sure everybody was on the same team. And I said, we're waiting on the cord unless there's a true emergency. I got thumbs up, and we moved on. Baby was able to stay connected to their placental cord for actually a whole 30 minutes at this hospital. So always having somebody ready to say that. Dads are awesome. A lot of times they're also now focused on baby and mom. They're not always focused on cord, which I realize is still part of mom at the time, still part of baby, but it is nice just to have one other person in the room, i.e. a doula, to say, we are waiting to cut the cord unless there is a true emergency. Moving on to, what if babies do need help? Many babies need to be assessed. There are many babies and there are true emergencies where the cord may need to be clamped or cut early on, and we got to talk about what do we do with that. Planning a C-section, there is still a chance for you to have delayed cord clamping. This is part of what's called gentle or family-centered cesareans. You can ask your provider, do you offer delayed cord clamping during cesareans? Dr. Hall is one of the most amazing breech OBs, just in general, flipping babies, birthing breech babies. He's a really amazing OB here in Colorado. And at one of the last births that I was at, me and the birthing family actually asked him about cord clamping and what it's going to look like, if there's any way that we can continue to have delayed cord clamping. And he said, actually, it's going to be safer for the baby if we have delayed cord clamping. This also makes me want to make sure that all other cesarean birthing moms know you can still have delayed cord clamping. It actually might be safer for your baby, depending on how the cesarean is planned or what's going on with mom or baby in that moment. Some hospitals will even hold baby at or below the placenta level to assist for that blood transfer. So that means sometimes, depending on where the placenta is and where baby is, when the baby comes out, sometimes they'll put the baby in a specific direction or angle so that the blood transfusion from the placenta to the baby is most ideal and still happening at its easiest rate, which is usually with the help of gravity. I feel like we've talked about this many times ago. Actually, yeah, we did with the placenta party episode. Lotus birth and leaving your placenta to naturally detach from baby. That's a very common practice in ancestral practices, but also indigenous practices around the world. So lotus birth is super cool. It's usually more frequently practiced with at-home births or wild or free births. If you're interested in hearing about the lotus birth, go watch that placenta party episode because it does have more information about it. It really just means exactly what I said. You leave the placenta attached to baby until it naturally detaches itself. And then there's also cord burning. Typically not practiced in hospitals because you can't have fire inside of a hospital, but so more at home, wild free births. Instead of cutting the cord with scissors, some families will use a candle to burn through the cord over several minutes. This process is slower, symbolic, and is said to reduce the risk of infection compared to cutting the cord in certain settings. Cord burning doesn't hurt anybody. It seems like it's like part of your body or somebody's body, so surely it's going to hurt. There's no nerve endings that actually connect to either baby or mom from the placental cord, so it's not actually going to hurt anybody, but it is a really cool way for families to make that barrier or make that bridge over of pregnancy to newborn life, and new bonds are made. And as always, things don't always go as planned. The only constant in life is change, and I constantly am experiencing that in the birth world. So if I'm experiencing it, I'm sure others are experiencing it. And I want people to be prepared, because even if you have this amazing, long, laid out plan, things always change. Things can change the day before baby comes. Things can change as baby's coming. Things can change as soon as baby does come. So things happen all the time, and I want us to be prepared with tools of how to walk into these situations with tools and not with, well, dang it, I missed out on my cord clamping. Dang it, my baby missed out on stem cells. Dang it, my baby missed out on all that iron. Well, there's still stuff we can do. There's always more that we can do. There's always healing to be had. There's always recovery to be had. So if the cord does need to be cut early, and you wanted it to be delayed, here are some things that you can still do. Sometimes early cord clamping does happen, and maybe your baby needs immediate medical attention, or birth setting doesn't allow for a longer delay. That doesn't mean it's all lost. There's still powerful ways for you to support your baby's transition. So here's what you can still do. And a lot of these do seem obvious because we've talked about them in a lot of other episodes, but they still matter here. Skin to skin immediately. As soon as it's safe, place your baby skin to skin on your chest. This will help stabilize their breathing, their heart rate, their body temperature, and stress response. This can all mimic some of the regulatory effects of the cord. All stuff we've talked about before, but all stuff that matters because just another aspect of pregnancy, labor, birth is the regulation of the umbilical cord. Isn't it cool that the umbilical cord can help stabilize heart rate, breathing, body temperature, and stress response? Crazy that it can do all of that. But if we can't do all of that, skin to skin does that immediately for baby. You can also delay baby's first bath. We talked about this in the microbiome episode. Keep the vernix on your baby. It is an antimicrobial substance and goop that helps with their immune protection on the outside of their skin and on the inside. Delaying the bath preserves baby's microbiome and keeps them warm. Ask about cord blood banking, if applicable. I know we just talked about it, but this is just something to talk about if you know that your cord is going to need to be cut immediately, if you know that baby needs immediate surgery upon delivery, if you know that mom needs immediate surgery upon delivery, if there is something that is going to separate baby and mom the second that baby comes out and that cord needs to be cut, ask about cord blood banking so that you can get the benefits of cord blood banking, since you're not going to get the effects or the benefits of delayed cord clamping. So ask about cord blood banking. If the cord blood is still being banked privately or publicly, understand that this typically requires early clamping, and weigh your pros and cons. All of what we just talked about earlier, weigh your pros and cons. But if you already know that this isn't going to be an option for you and you want to do cord blood banking, go ahead and do it. Talk to your team about it. Have plans set so that you know where it's going to go and you can take care of it at delivery, or your doula can help, or the birth team. Iron support later on. Talk to your provider about watching your baby's iron levels as they grow, especially between 4 and 6 months. If iron stores are lower due to early clamping, dietary or supplemental support may be recommended down the line. A lot of things can change with dietary shifts, but also depending on the season of year that you're in, how much time you can be outside, how much time you can be doing different activities. So it's always worth talking to multiple providers to get everybody's input so that you can make the best decision, but also trust your instincts. This podcast is all about trusting your instincts and understanding your body's deep, divine, intuitive pathway to being a mother and being a good parent. It was all built into your system way before you decided to have a baby or be a mom. So this is going to help. All of this to say, let the body finish what it started. The umbilical cord is your baby's first connection to life, and even after birth, it's still doing its job. In a world that often rushes everything, birth included, or especially birth, I might say especially birth, this is your reminder that you are allowed to slow down. You are allowed to say, let's wait. You are allowed to trust that your body, your baby, and your placenta still know what they're doing even moments after delivery. Delayed cord clamping is not fringe, frill, exciting. It is not alternative. It is a true physiological, backed by science decision and choice that moms can make and deserve to have the choice to make. It is something that most people don't even realize they can ask for. So now that you know, you can choose. I want you to choose. I want you to do your research. I want you to understand what's going to happen with your baby when they come out. What delayed cord clamping is going to be like. How you're going to have these conversations with your providers, with your practitioners. The conversation you might have with your doula so that they know. We want delayed cord clamping unless there's a true emergency, and you want her to say that regardless of what's happening. Stuff like this is how we feel more confident and safer walking into our labor and births, which allows us to have a more successful labor and birth. A simple understanding on delayed cord clamping is going to improve your birth outcome because you will have just a little bit more knowledge about what's going to happen, and you can feel safer in the moment of what's happening. anywhere where we can build more safety, more security around our choices, our understanding in birth and labor world, especially if this is your first baby, if this is your first birth, if this is even your second or third birth, you might still have questions that weren't answered the first go around, and we want you to feel safe. We want you to feel supported. We want you to feel understood and heard going into your labor and birth. So I hope this episode was helpful. If it was, please share it with another mama-to-be, your friend, a doula, your midwife, your partner, anybody. And if you've been enjoying the Popped podcast, please like, subscribe, rate, review, whatever feels good to you. I hope that you have a phenomenal week. If you have any questions that I didn't answer about cord clamping in this episode, please drop it below. I hope I answered them all, but if not, I will get back to you and I will answer some more if we need to. I hope you guys have a great week. I'm Dr. Emily, and you've been listening to the Popped podcast.